Training considerations for program design. Okay, let's discuss training status. So, obviously, prior to working with anyone, we're sitting them down, we're going through a smart start. If we haven't met with someone in some time, maybe this is a smart check, or maybe this is just a periodic check for someone you've known for quite some time that hasn't done any training in quite some time. And we're trying to get some foundational information on them. So, part of the Smart Path process does require us to ask a little bit about their exercise history. But what we really want to figure out is, how technical and what types of programs have they been on before. Maybe it was their own program. Maybe it was just, I got this out of a magazine and I just been following it. Seemed to work for a while, but it's not working for me any longer. You have to also consider the level of intensity in that program or what they'd been doing previously. So obviously, if they're deconditioned or if they weren't really working too hard, you're not all of a sudden going to give them, a Russian powerlifting program with tons and tons of volume. You're going to want to obviously ramp them up depending on what their goal is to get them where they need to go. Their degree of exercise technique and experience needs to be considered. So obviously, if they don't have a lot of experience with complex lifts, complex movement patterns, you might have to simplify those things. And then length of recent regular participation in previous training programs. This is sometimes called exercise history and or training age. So your training age is a little bit different than your chronological age. Your training age is, how long have you been training? So, currently right now I'm 46 years old. I've been training since I was 16, off and on. My training age probably at this point is, I'd have to say at least 25. I'm sure I've missed a few years in there. That's a pretty old training age, right? But when I was 16 and I started lifting weights, my training age was 0. Someone's potential for growth obviously is much higher earlier on in their training age than, having a 25-year-old training age. But we can quantify an individual and kind of figure out what's the frequency that might make best sense. And this comes from the National Strength and Conditioning Association. You see on the left-hand side, beginner, intermediate, and advanced. And then you can run across there and you see beginner, there's no training, or just very beginning. Their training age is less than 2 months. Frequency per week, probably 2 times per week, I would say. 1 time a week just doesn't really stick in the exercise science literature. This training stress is going to be relatively low, though. Technique is going to be very minimal. As we get into intermediate, we're looking at 6 months of consistent training, up to 6 months of consistent training, and they're currently training. Can go to 2 to 3 times per week. This training stress can be a little bit higher. Technique can be a little bit basic, but a little bit better than none or minimal. And then finally, someone who's over a year consistently training, they're going to have a little bit more of a more advanced. They may not be familiar with technical lifts because they still have to be coached in that, but their training age and their stimuli, their nervous system, their CNS, their physiology is really well adapted at this point, depending on how strenuous their training program was. So their frequency can be obviously 3 to 4 times per week, and everyone loves a 3 to 4 times per week client. But their training stress tolerance is relatively high. And their skills and technique probably needs to be high so that you can continue to facilitate adaptation. All right, let's talk about other considerations. So obviously, we have to talk about someone's goal. What does someone want to achieve, and what kind of program are we going to put them on in order to achieve that goal? We also need to look at their movement screens. So their FMS competency, are they moving well? Do we need to correct that? So we're looking at stability, flexibility, and motor control and how all 3 of those work together. Obviously, things we can't control, genetic potential, and, in general, structure and motor learning. High-level athletes are going to be very finely tuned, have a finely tuned CNS that they can adapt very quickly. We've all had clients probably that work very quickly, that you can teach them something new and set 2, they've mastered it, right? And they're able to move through exercise selection more quickly. Structure. So I say structure, but I'm really talking about, the goal. If the goal is I want to be a bodybuilder, I've always wanted to be a bodybuilder since I was a kid. I wanted to, look like Arnold Schwarzenegger. But the reality is I don't have those genetics. And so I'm not going to ever look like that. I'm only going to be a bodybuilding version of me, right? And so there's going to be limitations to my structure. One thing that's, that you can't, folks can overcome, a lot of stuff with determination and grit, right? That's heart. So if someone's really invested in training and they can overcome quite a bit, but that individual, you're going to have to probably pull back a little bit to make sure that they're getting enough recovery and rest to give their CNS time to relax and recover, so that their improvements, they don't overload their CNS, so that they can make good improvements between workouts. Other things to consider: balancing joint action, right? So if we're going to push a bunch of, like, I like to use the linear sort of push pull, hip hinge deadlift or hip hinge squat. The easiest way to look at this is, if I'm going to push one way, I really should be pulling the opposing way. That would be balanced joint action, right? So if I'm going to do a vertical push, I want to do a vertical pull. I may not do it in the same workout, but I want to get it done at least in the same week. I want to have a balance so that I don't develop an imbalance over the long term. One of the classic examples of developing an imbalance is if when you typically look at a standard bodybuilding protocol, which is, chest and tris, back and bis, shoulders, legs, you do anterior musculature, shoulders, pecs, upper pecs, and latissimus dorsi even to some extent in back, but you're doing exercises that are pulling the shoulder forward. You're doing those on 2 separate days, and you're only doing 1 day of really pulling. And so what you would want to make sure you do is balance out that joint action, so you're at least getting the same amount of sets, reps on both sides of the pattern, so as not to create an overload or an imbalance. Over time, that can develop into a pathology if we're not careful, so we want to be conscientious of that. And we should use our program design template to be able to evaluate, are we balancing joint action? Under that, I have unbalanced joint action. So what if someone comes in and they've got a training history and they just bench press their whole life, and they're upper cross like this gentleman here on the left? That gentleman doesn't need any pressing. That gentleman doesn't need any overhead pressing. That gentleman needs pulling. He needs mid traps. He needs mid lower traps and rhomboids. He probably needs his lats stretched out. He needs his pecs stretched out. He needs some FRC. He needs some thoracic extension. He needs to relearn thoracic rotation. There's probably some other stuff wrong with him too, but he's got to work on pulling his head back, right? So stuff that's tight, we have to work through. We may not want to even let this guy press. Maybe one day he gets to do 2 sets of 10 repetitions of push-ups. But for me, those push-ups are going to be full range of motion, retracting scapula, depressing, retracting scapula, and he's going to have to own that push-up. But I would then have 4 times the amount of pulling in this guy's program to help develop a little bit or restore some balance. Also, changing exercises. So there's very clear research that changing exercises seems to be, or at least helps facilitate strength gains and hypertrophy. This research came out not too long ago in the NSCA, about, I think it was 2 years ago. We know that changes in exercises are fantastic for helping the nervous system go, hey, what are we doing? We're recruiting differently. Let's make some adaptations. Your exercises, look, you're going to probably stick with a lot of the foundational exercises, but squatting and deadlifting and things like that. But you also want to incorporate variations on all of those. And we get into our program design template, you're going to see there's a whole bunch of progressions that we can go through that you'll have access to help you make those changes. So changes in exercises are incredibly important. We want to focus on full range of motion. So no partial range of motion, especially for our population. They really need to be working through full range of motion that recruits the most amount of muscle mass and the largest motor units, which means the largest muscle cells are going to get stimulated and they're going to get growth. So make sure we're doing full range of motion. We probably want to prioritize core stability over spinal flexion, as we talked about, especially if someone is seated quite a bit, especially if someone is coming to you having been seated. We don't need to have them doing a lot of crunching, a lot of sit-ups at this point. We actually probably have to work on stabilization. And so side planks, bird dogs, stir the pot, anti-rotation exercises, anti-extension exercises. Those are all going to be great for the core. We're going to want to resistance train at least 2 days per week. And I know I'm probably many of you out, listening to me right now. You probably have that client that just trains once a week, and it makes you crazy, right? Because they say, "Oh, I'll do some stuff on my own," or you write the program, you write them a workout. They don't do it nearly at the same intensity as when they work out with you, and their progress is kind of stagnated. So we really want to work towards getting everyone 2 days a week at a bare minimum. 3 days would be great. Look, if they want to do 4 and 5, then we have to start changing the way we program. It becomes a little bit more of a body part structure, but we can certainly do an upper lower for 4 days, 4 days out of the week. But in general, 2 days per week. The research is very clear. 2 days per week, full body training is a great place for all of the participants that we work with to be training. And then we want to think about periodizing, and we're about to get into this long term. So long term programming, a lot of you are like, well, what's the point? And even in 4Q, I heard Derek mention, in the programming, like, oh, if we just go month to month, and that's fine. You can go month to month, but at least they're going month to month. I would challenge, and I've talked to Derek and Michelle both ad nauseum about this. We have some clients where programming, they're in and out, they're traveling. It's harder to pin them down, to get them sticking to a program that has an outcome that they want to achieve. So maybe they don't periodize long term. But if you start thinking, 4 weeks, 8 weeks out in advance, and have a program pre-built for this person, if you're training lots of folks and you have programs that are pre-built, it makes your job much easier. It also shows the client, the participant, that, wow, this person has built something out for me in advance to help me to achieve my goal. There's an element of professionalism. And I really would challenge anyone listening to this module to periodize out long term. 4 to 6 weeks is a great jumping off point. And the templates that we're going to give you here in a moment will allow you to do that with a little bit more ease. And we have some programming structure that we're going to go through to help make that a little bit easier for you. Programming phases. So let's talk about the recipe to achieve the adaptations that your clients want to achieve, or yourself want to achieve, right? This comes from the Essentials of Strength Training Conditioning, the NSCA, 4th edition. This has been around for quite some time, and this is pretty well-known science at this point, that there is a very specific protocol depending on what you want the muscles or the muscle tissue, the muscle cells themselves, how you want them to adapt. We're looking at, the more endurance-oriented we are, there's more mitochondrial density, there's less contractile protein, actin myosin filaments. So you're going to be better at endurance-oriented sports, right? You get what you train for. The more bodybuilding we do, well, it's a combination of the two, but you're going to get more hypertrophy, you're going to get more fluid retention, you're going to get some cross-sectional protein fiber, getting more actin myosin cross-bridging, and you're going to maximize hypertrophy there. Strength is very specific, and you're getting more cross-bridging, but you may not get maximal size. Power is speed, moving a heavy object fast, right? So there's a speed quotient there. So working on technique and really being explosive. So if you look at endurance, notice sets, 2 to 3 sets, repetitions are equal to or greater than 12. Percentage of 1 rep max. So the heaviest you would be lifting is 67% of your 1 rep max. Your rest is 30 seconds. So very short amount of rest. You're just going to keep moving, but it's lower intensity. Hypertrophy training, 3 to 6 sets, 6 to 12 repetitions. Percentage of 1 rep max ranges from 67% to 85%. So the loading is getting heavier, and the rest period should be 30 seconds to 90 seconds, or a minute and a half. And then if you're training for strength, your protocol looks pretty different. Your 2 to 6 sets, less than or equal to 6 reps. Percentage of 1 rep max is going to be greater than 85%. Your rest is 2 to 5 minutes. So this is why you see folks hogging the bench press or just hanging out there. They're waiting, right? They're waiting. They're trying to get all of the regeneration to happen, right? So their energy system's fully restored, and they're ready to to be explosive again for a few seconds. And then finally, power. Similar to some extent in strength from a rest standpoint, 2 to 5 minutes, but depending on if you're doing a single repetition or multi repetitions, you have a little bit of a different range. So there's 1 to 2 reps. You're going 80 to 90% of your 1 rep max. 3 to 5 reps, 75 to 85% of your rep. 75 to 85% of your rep max with 3 to 5 sets. So this sets up a nice structure. This will be downloadable for you and available to you. I've actually used this with clients who have told me in the past, hey, I've been training with so-and-so, and I said, well, what's your goal? And they're like, oh, I want to tone and firm. Great, that's a hypertrophy. And what reps and sets have you been doing? And they're like, oh, I do like, 2 to 3 sets of like 20 reps. And I'm like, okay, well, show me on this page where that falls. And they're like, oh, it's endurance. Yeah. So the adaptations that you're getting are going to be more in line with endurance. That's not, while you can tone and firm, slow twitch muscle fiber, type 1 muscle fibers, they can hypertrophy a little bit. But if you're really looking bang for buck, we want to kind of focus on a little bit more hypertrophy. So this is a nice tool that you can use certainly for programming, but also as a resource when you're talking with clients. It's very convenient to have this in your assessment room as well. So please be sure to download it.